It's likely that you have someone close to you in your life that deals with chronic fatigue if you don't deal with it yourself. Chronic fatigue syndrome can be characterized as severe fatigue lasting longer than 6 months, as well as the presence of at least 4 of the following symptoms: feeling icky after exercise, unrefreshing sleep, impaired memory or concentration, muscle pain, widespread joint pain, sore throat, tender lymph nodes, or new headaches. While there are multiple symptoms associated with chronic fatigue syndrome, the underlying commonality is severe fatigue, poor sleep patterns, sleeping but not waking up rested, and symptoms like that. This can have lasting effects on the whole body. Simply put, sleep is our body's opportunity to heal and recharge. It's during sleep that energy stores get refilled, damaged cells get repaired or recycled, toxins get flushed out, and the body and brain store memories and lessons from the day's experience. When we don't sleep, the body doesn't have the opportunity to regenerate and heal. Toxins don't get flushed from the brain, and the immune system suffers. It's no wonder that so many people that deal with chronic fatigue syndrome also struggle with other symptoms related to function of the immune system and mental clarity. So what regulates our body's sleep? Ultimately, like every other function in the body, that is the responsibility of the nervous system to regulate our sleep-wake cycles. Many know this process as the circadian rhythm. The body uses cues from its environment to know when it should be awake or resting, such as sunlight, when we intake food, and other things like that. Through the brain and the hypothalamus, the nervous system begins a cascade of neurotransmitters and hormones that ultimately maintain balance in the body. We call that homeostasis. The body can either be in a stress response or in a rest, digest, and heal response. It cannot do both at the same time. And it depends on the adaptability of the body and the nervous system to determine how well and to what extent the body's capable of making that transition. We have ways of scientifically measuring just how well the body makes this transition, which we utilize in the office to help guide our care and measure your results. So what is chiropractic's role in chronic fatigue? At its essence, chiropractic is all about improving the way the body not only responds to stress, but most importantly, how it's able to heal itself. Chiropractors analyze the spine to detect misalignments that are contributing to impaired neurologic function. Impaired signaling of the nervous system directly affects the functions of all tissues, organs, and glands associated with that specific neurological distribution. If this nerve interference is in an area that's related to the body's rest, digest, and heal centers of the nervous system, then restful sleep, digestion and absorption, immune function can all be interfered with. Often when we are able to correct spinal misalignments contributing to that nerve interference in these areas, improved restful sleep is one of the first things that our practice members experience. Many who receive adjustments to this area of their spine are yawning before we get them up from the table and fast asleep when we check on them during the rest period after their adjustment. This is a great initial response. Heart rate variability, also known as HRV, is one objective tool that we use in the office to measure the effect of chiropractic adjustments on the body. Research and our experience has shown significant improvement in HRV in people under chiropractic care, showing increased adaptability, a better ability to handle stress, and a more effective transition into that restful state. When the body's able to sleep and recover better, it can pretty much do every other function better as well. The ability to rest and recover is becoming increasingly difficult in this high stimulus, high stress modern world that we live in. And we find that a lot of people, their body has difficulty shifting out of stress into that restful healing state. That's going to set us up for growing into issues because the body's not able to recover. There are, of course, other supportive interventions to help those dealing with chronic fatigue, whether that be nutrition, detox, addressing underlying infections, and several more. But neurologically based chiropractic care is what we know and do best at Pascal Chiropractic. If you have questions, concerns, or would like to further the conversation, please don't hesitate to reach out.